Broadcast is now starting. All attendees are in listen-only mode.
Good morning. Welcome. We're so happy that you could join us this morning. My name is Tamara Bingham Noyes. I'm the Director of Business Development at Center for Change. We're joined by Melissa Taylor. I'm coming to you from my home office in Salt Lake City, and Melissa is coming to you from the center in Orem. Just a little disclaimer that my IT specialist is my dog, Izzy, so cross your fingers that the technology stuff all goes as it's supposed to. So we're going to do our very best. So we're so happy that you could be with us this morning. We have a lot of folks that are joining us today, and we have many attendees that are still logging on. So I'm going to go a little bit slowly and talk about the things that are on the screen that you can see currently. We have just a little bit of housekeeping things that we need to do first, and then I'll turn it over to Melissa for her presentation. So as you'll see, a copy of the PowerPoint slides is in the handout section of the toolbar. You're welcome to open that up and follow along if you'd like. Also in that same handout section of the toolbar is a copy of the post test. And you're welcome to open that up and take a look or print it off or whatever, and keep an eye on it throughout the presentation. However, keep in mind that to obtain continuing education credit, you must take the post test online. So the one that's in the handouts pane of the toolbar is just for your reference only. You are welcome to submit questions in the questions section of the toolbar. So those are, everybody's on mute so that it's not too chaotic. And so go ahead and if you have questions, submit them in the questions section that's on the toolbar. I keep an eye on those throughout the webinar. And then at the end, if we have a few minutes, we'll answer a few questions and I'll just verbally give those to Melissa at the end of the presentation. Once the webinar is completely finished and we say goodbye and I click the screen to end the webinar, then an evaluation will pop up. That's a continuing education requirement for us. It's an anonymous evaluation. It gives us feedback about how we did on the webinar, and it's something that we're required for our continuing education folks. So if you would be so kind as to take just 1 minute to complete that evaluation, it goes very quickly. It would be really helpful for us and we would appreciate it. Not only is it a CE requirement, but it just helps us to know what we can do better in the future. So that would be really helpful. About an hour after the webinar ends, you'll receive a separate email with a link to take the post test. And as I mentioned, you must take the test online in order to receive continuing education credits. So as I said, about an hour after the webinar ends, watch for an email that comes to the same email address that you registered under. And in that will be a link that you can click to take the online test. You must pass the test. And once you do, then it automatically downloads a certificate to your computer. And so you can print it off or save it or whatever. If you don't see it, look in your downloads file because oftentimes it'll be there and sometimes it's not clear about where it might be. So hopefully that's helpful for you. We're going to go ahead and get started. I'm going to back out here and turn off my camera and my microphone, and I'm going to hand this over to Melissa. I'll let her introduce herself and get going on the presentation. Melissa, I'm going to just change the presenter now, so it should be coming to you shortly. There you go.
Okay. Hi, everybody. I'm Melissa. I'm going to just introduce myself, and then I'm going to turn my camera off because there's probably going to be a lag for some people between what I'm saying and my lips moving. That could be irritating. I am the Clinical Services Supervisor at Center for Change. I've been here for 16 years. So the Clinical Services Supervisor oversees all the therapists and all the levels of care we have, inpatient, residential, and then we have 3 PHP IOP outpatient programs in Orem and in Cottonwood Heights in Salt Lake City and in Boise, Idaho. So I'm over all of those things. I'm a marriage and family therapist by trade, and I went to the University of Kentucky for my master's degree. So I'm going to switch up now. I have a lot of information to get to. Like Tamara said, if you have questions, please just let her know. So ambiguous loss is a theory that I heard about 3 years ago from my friend Jeff Jackson, who is doing a presentation on this. He was doing ambiguous loss and being single. I went to his presentation and I really fell in love with this theory. I feel like it's very applicable to what's happening in our society and our culture and our world right now. There's a lot of loss going on and a lot of anxiety that goes along with that. Let's see, Tamara, okay, there we go. I was having technical difficulties, but I'm okay. What I really wanted to talk about to begin with is the term wabi-sabi. It also has some other names, so you may know it by something different, but this is the Japanese aesthetic concept where beauty is seen as in the imperfect and the impermanent. And so something that is broken does not get thrown away in their culture, like these beautiful pottery, but they're actually fixed with something that makes it more valuable, something like silver or gold. And it's so when we go through a time of loss, oftentimes we feel like we go from something that's broken and we wonder how we're going to be put back together again. A lot of times this is what our patients are feeling right now. Every call I have, even though I'm an eating disorder specialist, is all about COVID and their anxiety and how it's changing their life. Some of the changes that we're making in our program to help with the changes for COVID, such as telemedicine, social distancing, some other things, are showing us new directions and ways of thinking that we never really thought of before. Pauline Boss's work, Ambiguous Loss, is relatively underused, I would say, in the clinical realm. Pauline is a marriage and family therapist. She lives in Minnesota, and she developed ambiguous loss theory after the Vietnam, or during the Vietnam War, where prisoners of war and the MIA were causing a lot of distress for families, and I'm going to talk about that in a minute. These two resources are really great. The top book in the purple cover is for the layperson to read about ambiguous loss, and this one in the green down here is for clinicians. It takes more of a theoretical background and approach. So if you're interested in learning more, these are just two of her books. She has several others that are very helpful. When she coined the term ambiguous loss, she defined it as an unclear loss that defies closure. Oftentimes, it does not have validation, clarification, or resolution. And so she really focuses on the problem is the loss or the stressors that loss brings. It's not pathology. And this loss can tend to have increased conflict in the families. And if an individual is feeling anxiety or depression, that can come. But again, that's not necessarily pathology. It's just an adverse effect of all of the changing that's going on. She said the human experience is never one of certainty or predictability, but with the support of caring family members, friends, and neighbors, as well as the comfort that some derive in spiritual beliefs, we learn to hang on during such inevitable emotional rides. So what is ambiguous loss? There are two types of ambiguous loss that she identifies in the literature. The first is leaving without goodbye, or physical absence but emotional presence. We're seeing that a lot right now, that a lot of people are on their minds, but we can't get to them. Either there's a physical boundary that we can't travel to see them, or maybe that there's a job loss or some separation between us and our coworkers, things like that. So COVID is really putting a lot of pressure on us to find other ways to be there emotionally and physically. This theory also, of course, goes beyond COVID. So in a family where there's been a child that's been kidnapped, a stillborn child, someone in jail, someone in treatment, which my patients say is like jail. Being single, someone is in your mind and in your heart, but you don't have them around. You don't have access to this person. Divorce, infertility, children at college, someone in the military, placing a child for adoption. They're physically absent but emotionally present, and missing persons. If we had time, I'd go through some case examples of these, but I think it pretty much touches just about everybody in that way. The other type of ambiguous loss is actually being physically present but emotionally absent. And you might be finding that in your families or in the people you work with. Maybe you have someone who's a loved one, a doctor, or someone who's constantly reading the news right now, or turning on that channel, that news channel. So physically they're there, but emotionally they're just so worried about what's going on that they're not the support person that they used to be. That's how it relates to COVID right now. Other just general examples are maybe someone's having an extramarital affair, so they're physically present, but emotionally they're not there. Mental illness in general, addictions, be someone who's a workaholic. That could be if right now, if you're related or married to somebody who's in the healthcare profession, they cannot stay home. Maybe they're having to work even more than they were before. Dementia, a lot of Pauline Boss's research talks about Alzheimer's and how this has been applied to that population. Brain injuries, severe medical issues. Maybe you have someone who's in your life, but they're physically present, emotionally absent because they're quarantined. Maybe they're quarantined to a specific room in the house or quarantined to another place so you can't get to them. And then children with severe disabilities. Boss's research has been used in a variety of settings. I think the one that really hits home to me during COVID is her work with 9/11, and I'll explain that in a minute. But again, she used some of her start with the POWs and the MIAs in Vietnam, where families were in crisis. They didn't know how to move forward because there was this huge loss. They didn't know when their loved one was coming home. They didn't know if their loved one was alive or not. And so she developed 6 principles of resiliency, which is the majority of my presentation. How can you help yourself? How can you help your family? How can you help your patients through this time? And so she has these 6 principles of resiliency. She's also used, or this research, her research has also been used with military deployments, teaching families how to have partial boundary closures. She talks a lot about ambiguous loss actually being ambiguous boundaries and making sure that we have some clear boundaries set, even if we have to change them around so that the family can continue to operate under new conditions. So I think this is happening. For example, in my own life, you may have to have, like, I will go grocery shopping for a loved one, but I can't sit there and talk to them. I can't interact with them. I can't come in the house, those kinds of things. So when the soldiers went away, they had 3 different stages: preparing for them to leave, while they were deployed, and coming back. And the families that did the best were able to move their boundaries around and have some closure, specifically with information that was happening in the war zone, which is really important in COVID. They found that families, when they knew that their loved one was in harm's way, they stopped listening to the news as much, and this actually helped their mental health and helped them just be able to stay close to their loved one without getting stressed out as much. The 9/11 was a really interesting research study. She, like I said, is from Minnesota. She went to the city, and she said that was a very different context for her. And she found that the therapists who were used to doing family or group therapy did a lot better helping these patients than, or these people who are victims of 9/11, rather than the people who were just doing individual psychotherapy. Because in ambiguous loss, the theory and the interventions are relationship centered. It's a relationship disorder. So in our COVID situation, we need to kind of rally and say, all right, who is part of this family or who is part of this group that I need to involve in the therapy or in the healing process? It's maybe not just the physical family members. Like I said, it was used in Alzheimer's, and it's also been used in foster care. That was a really interesting study where everybody kind of sees these foster kids acting out as a bad thing, and she takes it and she looks at it as an ego strengthening thing, that these kids are trying to be resilient, and that's why they're taking the power into their own hands and being able to use their voices, and it's in a way that is probably, again, in the wrong direction, but showed ego strengthening. So she uses her resiliency to not pathologize what's going on in the loss, but actually finding ways to highlight how strong we are and how we're going forward. Specifically in the 9/11 one, which I think is applicable to COVID, that research study, which was the 2003, the Boss 2003 reference, she talks about how older members of the community, specifically grandparents who had been through difficult times before and had resolved that ambiguous loss prior in their life, were actually really helpful for families because they could really provide a foundation of strength. So in this time of COVID, I think it's important that we involve the elder members of our community who may have been through settings like the Vietnam War and other things that were very difficult. I remember in the 70s when I was young, we had to go to the gas station a certain day because the gas was rationed. And so if you have people in your family who have already lived through this, they can help provide some healing and context, like we can get through this. I already explained a little bit about how ambiguous loss, physically present, emotionally absent, or vice versa, can apply to COVID. But what I just wanted to highlight are that people are losing connections left and right. And if I am back on my screen, I would show you my mask that I wear every day at work. So I don't have a medical mask, we can't get them, so we have homemade masks. But even when you put a mask on to protect you from your surroundings, that is a different kind of loss in the community because everybody is trying to do this boundary setting. And my brother lives in Manhattan. He kind of talked to me about it's really difficult because it's such close quarters that you're trying to stay away from everybody out of protecting them, but also there's a sense of like, you know, everybody could be contagious, and we feel that here in non-close quarters as well. So it's something that is but definitely changing our surroundings. So we're losing connections. Sometimes parents aren't able to get to their kids who are at college. They've had to drive them home across the country, those types of things. Sometimes the kids are at college, far away. Do they have enough toilet paper? Do they have what they need? The medically compromised, hear stories in the media of people who cannot visit their loved ones in nursing homes, and this is a heartbreaking thing for them. I know some people who are pregnant right now, about ready to deliver, and there's talk about who can even come to the delivery room. If your kids are in treatment, you aren't there to be able to protect them. There's a sense of anxiety about that. Also, the COVID is affecting people's relationships at work, and fear over your loved ones who could be put at higher risk because they're a healthcare provider. Ambiguous loss theory talks about the loss is not always seen as problematic or an issue. So we look at some of the Native American cultures, and in her research, she found this, that the Native American cultures, when they're looking at loss, they actually have a much more accepting way of viewing this. I was listening to NPR last Saturday, and they had a woman who's from the Hopi tribe. I put the little link in there. She talked about COVID actually being seen as something that is cleansing right now, and the earth is sort of repairing itself. So certain cultures may see it as something that's kind of a progression and a healing process instead of something that's so traumatic and a loss. So if someone is feeling that way or having that view, it's important to accept that and not to push them towards anxiety. It is considered problematic if decisions are being put on hold. I think probably you're seeing a little bit of that right now in the community. Well, I can't decide that right now because I don't know what's going to happen in 6 weeks from now or 2 months from now. It's also problematic if other family members' needs are not attended to. So if someone is really having to absorb a lot of the family resources and the other members of the family aren't getting what they need, it can create some stress in the family. When daily tasks aren't done, it's considered problematic. Family rituals are canceled. It can be difficult. And when the psychological pain from this COVID, if we don't attend to it, it can actually build up and become unresolved. And if untreated, it looks very much like, her research looks very much like PTSD research, has some similarities. So we need to make sure that we work through this in the next year so that it doesn't become something that becomes a long-lasting problem. Just for the therapists out there who are interested in knowing the conceptualization of the theory, here are some of the main tenets of the theory. So challenging the human desire to have, to know, or to be certain about the future. So again, it's a lot of this mindfulness and DBT where we don't know right now what's going to happen in 3 weeks or 6 weeks. We have some of our best people predicting what may happen in certain situations. That's why I think the leaders of each state are on the news saying, my state needs this, my state needs that, because they're trying to make what's uncertain certain, and they're trying to get resources, and that's just an unknown. And so one thing that we need to do as therapists is sit with our patients and help them understand that right now we're not going to have all the answers, and we need to be able to rely on each other, talk about how we feel instead of focusing on that strong desire to know. There's no absolute truth with ambiguous loss because we don't know the end. So we need to really challenge using our CBT skills at absolute thinking. We have to understand how to change or move forward despite not having clear answers to our losses. We need to discover how to live with trauma that comes out of the loss. So again, really talking to your patients about not just the loss, but what it's doing to their anxiety, their depression, their relationships. We need to create a perspective of clarity when the loss is unclear. So just naming it, telling them you're going through what's called ambiguous loss right now, and this is what it looks like, and this is how it feels, and it's not something that's a pathology. It's something very normal. Everybody's going through it. When I did this presentation about 2 years ago with my patients and talked about how their eating disorders are a type of ambiguous loss, they said, oh my gosh, there's a name for what I'm going through. I had no idea. So this was very helpful for them. This loss is real and we can't measure it. We can't say someone's having more or less, or this is the degree to which it's impacting, because it's very nebulous. It's a relationship disorder. There's finding closure in this is unrealistic. We need to look for finding meaning. And a lot of my presentation is going to be on finding meaning. And resiliency is the tolerance of ambiguity. Again, with family as relative, we don't want to have somebody excluded from the treatment when they're an important part of the family. So what it looks like is actually depression, anxiety, family discord, grieving, confusion, hope, then hopelessness, shock. And so a lot of times it looks like things that we would diagnose as, major depressive disorder, generalized anxiety disorder. Maybe, in the old DSM, some of the family, the V codes, things like that. So we have to acknowledge what they're going through and talk to them about how to get over that initial shock and into resiliency. When she studied families in 9/11 and POW, what she found was that there was something called frozen grief, that if people weren't able to acknowledge how they were feeling and find resiliency techniques, they were actually stuck in place and they were unable to move forward within the crisis of taking care of their basic needs. There was sometimes a lack of information or lack of sense of control that was creating this frozen grief. There were uncertain roles, like he used to do this and now I'm in charge of it. Do I sell the house? Do I pay the payments? Do I do this? Do I do that? So these things have to shift and change. That's where family systems theory is very important in ambiguous loss. So if you have something that needs to get done, but that person is now unable to do it for whatever reason, we need to be flexible. And we need to reach out for support from others. If we don't, we keep that frozen feeling going. I do want to say one thing about that last bullet point. Ambiguous loss, when researched, actually shows that it is more painful than death. So with death, you kind of understand that this person is gone, they're not coming back. With ambiguous loss, we don't know the ending. It could go on and on for weeks, for months, who knows? Will this go away and come back in the fall? And so this kind of stress on a person's psyche is actually more difficult to deal with. So we want to make what they're going through a normal grieving process and address it in therapy. We want to help the patients understand these challenges and give them coping skills. And so that's something that we really want to be careful of. We want the family to stop pathologizing anyone who's having a harder time to this COVID response. That could just be where that person's at, and we don't want to make it like they're mentally ill because they're going through this grieving process. So get as informed as possible. Expect to feel your emotions go up and down. That's dialectical behavioral therapy, where you can feel two things at the same time that are opposite spectrums. Telling your story is very, very important in ambiguous loss. Please give a chance and a place for your patient or your loved one to tell how they're feeling. And then we have to learn how to live in the unexpected. Blaming doesn't help, and so that's really important to stay out of that. When I say get as informed as possible, there's also some boundaries around that. Like I said with the military families, if you get too informed, that could maybe not be a good thing. So get your information from the correct places. This is just a little image I got from North Carolina. It was their government COVID image. And I put that on there because you want to get it from the correct places. I see a lot of things on social media that may or may not be accurate. And so it's important for people to get their information where they should, not to get too informed, spending 6 or 7 or 8 hours a day on these sites, because that tends to heighten the anxiety. One of the most important things you can do as a caregiver in this situation is have empathic responses. So teaching the family to listen without judgments. I think I had this on another slide, but I'll just say it here. There's a lot of political discord. And so a lot of people are saying, well, that's not what I heard, or that's not what this person is saying, or this person's an idiot, those types of things. And so when we listen, we just have to listen and just go for the underlying issue of what's really there, instead of fighting about, you know, who's right or who's wrong. We need to ask a lot of questions without our own assumptions. Kind of goes back to the first bullet point. Responding with warmth. I think as a therapist who is now like a COVID task person, I've never done this before. I've had very long days, and I think there are times where I have been exhausted and kind of frayed. So it really helps to self-care, because you want to be there from a warmth perspective and not a critical perspective. As a therapist, you want to make sure that you're prepared for the length of the journey. Don't expect that you're just going to do 1 or 2 or 3 sessions about this and then it's done. You may have to do this over and over and over again. And I see this with my eating disorder patients. It takes 22 years sometimes for them to recover. I don't think it will take that long in this situation, but it could take months. And so you need to be able to be there without, you know, internally rolling your eyes or making judgments like this person is just too anxious and needs to be done with this. Remember the phase of change and Prochaska. So if someone is really in a difficult spot and they're not able to change, meet them where they're at so that you can have an empathic response for them. You want to look and see how all the members of the family are doing, because if some family members are having a more difficult time, they're not going to be able to process what's happening right now because they're stuck or frozen with other losses that haven't been dealt with. So get educated. Don't believe that you have all the answers. We've never been through this before. We're learning as we go. Ask people to tell the truth. One thing that we really are pushing for here is, we work at a hospital. You have to have the assessment questions about if you have a cough, if you have, you know, a fever, we take your temperature, all of those things. We need people to be honest and not withhold information that could be important for the rest of us to know. So if someone you love is telling you, I'm too sick to go to the grocery store, that's really important information. How are you going to process it? And thank them for, you know, being honest and not just, you know, wearing themselves out and getting other people in danger. Let's move on to resiliency. So individual resiliency depends on a person's ability to live comfortably with this ambiguity. So again, we will fare better if we're able to kind of roll with the flow and go with the journey and adapt to the stressful response. Again, because she's so family oriented in her responses, it's really important, even if you're doing individual therapy, to have a loved one on the phone and say, how is it going for you? How's the family taking this? You know, what are you guys afraid of? What are you patient with? How are you dealing with not knowing how this is going to end? Blame is something that usually happens in this process. Like, I told you not to go to that business meeting. Your coworker was diagnosed. Now you put me at risk. We have to understand that we do the best with the information that we have when we have it. People are walking around asymptomatic for either they have it and they're asymptomatic, or they don't know that they have it because their symptoms haven't come on yet. So we have to make our daily decisions with the best information that we have and go from there. So blaming each other is not helpful. This is just for people who may not understand what dialectical thinking is. It is a concept that grew out of Middle Eastern philosophy of being able to be still and mindful when two things are kind of coming at us from different directions. So we can be hopeful and hopeless. We can feel frustrated and we can feel grateful. And it's really important to use that word and instead of but. I understand you're feeling so frustrated, and I see that you're trying to hang in there and that you're trying to hold on. And so using this dialectical thinking really encourages families to have hope when things aren't going well. Have them identify concerns that they're having right now. So one of my concerns is I'm isolating from my friends and I don't have that support. Or one of my concerns is I see my spouse checking out from life and watching this news nonstop. Or one of my concerns is I had all this money saved up for college and now I can't go, or now I have to use the money for something else, and it's delaying things that I was really looking forward to. I see this, I don't have this personal experience, but I see this a lot on social media, is that people who are adopting to new roles, such as I'm a school teacher now for my kids, it's very stressful for them. They're having some chaos and anxiety in the home. They're trying to do their job at home and they're trying to do homeschool, and it's a frustrating experience. So helping them understand that this is something new, we're doing the best we can, is really important to identify some of these concerns. Other concerns, such as I lost my job or I'm missing the role that I had at work, that daily coworker interaction, I'm concerned about my medical health. Maybe I have COVID and I'm concerned if I will get better or not. Those are all things that we need to address right now because they're really important. So how do we get through it? What are the 6 steps? One is define meaning. Carl Jung said, meaning makes a great many things endurable, perhaps everything. So going back to the Hopi tribe woman who said there's some meaning in this, that's one way of looking at this concern. Other ways that you can find meaning is seeing how this experience is impacting, as a clinician, you, and how you can use that to help or hinder your patients. So if you're feeling like you're stressed out and you're giving this problem a very negative meaning or connotation and not looking at what could be positive in the situation, you're probably passing that along to some of your patients and coworkers. So yes, my mind may feel out of control. I don't like that my loved one is suffering, but how am I helping that person? How am I helping myself? How am I learning patience? It's really easy, for example, to go to the grocery store. I was in the grocery store the other day, and this elderly woman, probably in her 80s, was trying to buy some water, and she had too many things of water, and she had to put some back. And then she couldn't read all the signs and understand. And I asked her if she had her basic needs met and if I could buy something for her. That is considered, I think, something that we could do that's really simple to build a sense of community with one another. I had a family member buy groceries for a widow who can't get out of the house. That's creating meaning. That's the family pulling together. Rituals. Rituals create meaning. So if you are able to, instead of getting together for a Sunday dinner with your family, getting together for a chat via FaceTime or Facebook, calls where you can see each other. Maybe this is a new ritual that you and your family will do. So what are the rituals we can do in COVID that are new, but that still connect us to our old rituals? So some churches are going online. Some treatment programs are going online. They're offering care. You see this all over the world. People are having concerts from their balconies. Neighborhoods are having parades, car parades, where you're at a social distance, but these are still things that we can do to create new rituals, but the same meaning of togetherness. Am I able to help my community? Am I able to donate? Maybe I overstocked, maybe I over prepared, and I know there are homeless people. Can I donate some of my food to those in need? Am I willing to go out and shop for people who can't shop? We are able to create a greater good right now. 2, tempering mastery or adjusting mastery. So originally her research talked about the fact that we like to have control over our life. That's the mastery part. And that we have to understand that we can't control everything. She went to Japan and her research was used there after the tsunami. People went missing. And what she found in that culture is maybe people needed to do a little bit of the opposite of the American way. We want to have all the control. They kind of let things flow, and they needed to find out ways that they could do more control. We needed to find ways we could do less control. She says the most important predictor for resilience in the face of ambiguous loss is an individual's ability to learn how to hold 2 opposing ideas in their mind at the same time. Living well with ambiguity means that people have learned to live well with conflicting ideas. So if you have too much control, that's not a good thing, because you're probably going to drive everybody around you crazy, because there's not a whole lot that you can count on to be consistent right now. If you have too little control, well, we'll just see what happens. You may not be preparing enough. In your head, not only what you can do like with control, but what you can do is also say, I understand that what's happening around me does not necessarily reflect what's going on inside of me. Bad and good things happen to bad and good people. So what you're doing is not necessarily going to create, if I do all these good things, I'm not going to get the COVID virus. That's not how life works, and so understanding that good and bad things are something that happened to all of us. No one deserves to have this COVID virus. So we have to avoid thinking like, well, I was being good or I was doing good, and so I shouldn't be affected like this. These healthcare workers are a really good indication of this. Like, they're putting themselves in harm's way, and some of them are being greatly impacted, even giving up their lives for this. Accept life challenges and change what you can, and understand what you can't change. It's that whole 12-step piece in the prayer of serenity. Think about all the hard times you've been through, and you've been able to overcome, and you haven't been able to control everything in the past. The decision-making part is part of this tempering mastery. That's really important. Don't be paralyzed in your thinking. Turn towards your family. Why would you want to go through this alone? Don't try and put the stiff upper lip, brave face on when you need to emote or lean on others. Trust your treatment team. If you're in some kind of treatment right now, outpatient or otherwise, and your team is telling you, hey, I think these are things you need to look at, trust them right now, and turn towards them. Be willing to change your ways about connecting. If it's not working, find a different way to connect. Making your decisions. You can't manage all of these decisions right now alone. We as a team, we have COVID meetings 3, 4, 5 times a day. Some of us have individual meetings with certain people, and some of us are coming then collectively. And we're going through all of the information we have, and we're asking each other what the best scenario is. As you're going through this, make sure that you're turning to the people who are professional, either with mental health or with medical, when you're making your decisions. And keeping your cup full, because trying to go through this and being able to adjust what you can control and what you can't control is very draining. Find that inner peace. If I accept that this is the situation, I can move forward. Understand where your good resilient characteristics come from and where you've used them in the past. Try to seek calmness and mindfulness. Understand that you can feel your feelings without judging them. Again, with the DBT, there's a lot of DBT in ambiguous loss. The third thing she wants us to do is reconstruct our identity. And I think a lot of people are going through this right now. Who am I right now? When I heard my friend Jeff Jackson speak, he talked about this in a different context, of course, not COVID, but he was saying, you know, you must never forget COVID's going on, and we also have to kind of forget COVID's going on, meaning that when you're on your calls with your family or your friends, you're talking about other things in life, not just COVID. So we need to remember to talk about it, and we need to remember to do things that have nothing to do with COVID or talk about things that have nothing to do with COVID. You could have an identity shift right now because there are things that are so different. You know, I am a certified eating disorder specialist. I don't know what to do in pandemics because I've never been in a pandemic before. And then we had a pandemic and an earthquake last week. And so it was like, now I need to know how to identify earthquake preparation, COVID preparations. And so as part of the COVID team, it's really important for me to stay away from judging myself. I've never done this. I don't know what is going to happen in the future. So I have just identified that part of my job right now as a leader is to be able to have daily conversations with staff about their anxiety and what this is doing for them, and to be as honest and helpful as I can. Because it is a family, ambiguous loss is a family-based not problem, but concern, I guess. We want to have the family come together and everybody practice their own individual strengths and resiliency as part of the family identity as well. So if so-and-so is really good at, you know, listening, and so-and-so is really good at taking tasks and making sure they're done, and so-and-so is really good at connecting with kids and wants to do the homeschool, that's what we do. We expand our roles to be more effective. And we increase our spiritual sense of self. That's one of the things she found that was really important in your identity, is to understand who you are from an inside out, instead of all of these things are changing. Maybe you got laid off, or maybe your patients are getting laid off, etc. If they have their identity just in what their job description was and not in their spiritual sense of self, then they're going to have a hard time on this journey. So really going down deep with the person and saying, you know what, this is a stressful time. A lot of things are changing. I know you don't have work right now. This doesn't change who, that you're a hard worker. This doesn't change that you have talents and gifts. What you don't want to do, I talked about this a little bit already, is, you know, start fighting with who's right, who's wrong, or isolating yourself from the community. I had a friend reach out to me. He knows I love to read. He says, I know that this company is doing free online books during COVID. I thought you might like that. So being able to share your knowledge and your gifts with other people, and don't keep yourself in a role that isn't working. For example, if you're the one who's constantly being the family rescuer, then you need to ask for help from the other family members. I can't do this alone. If you don't know how to teach school to your little ones, because that's not what you do, ask for help and stop kind of torturing yourself that I need to be able to figure this out. Who would you describe yourself to someone else? Would you say, oh, I'm a person who's afraid during COVID? Or would you say, I'm a person who gets anxious and I need the love and care and concern from, you know, my friend? And how would you be able to kind of see yourself outside of this pandemic situation? That's really important to hold on to, is understanding how this might be changing you and how this might be, you know, making you better, but not taking away from who you were in the past. Things that I've asked my patients before is like, well, I've never been through this. What are you learning about yourself right now? What are you learning about yourself during this pandemic? I had a patient I was talking to yesterday, and this patient was like, I learned that I'm prepared. I learned that this hasn't changed my life so much. It's kind of life as normal. And I've heard a few people say that. I've heard a few people who say, I never knew I was so extroverted and I needed, connection so much. And now I'm learning that about myself. And so just coming from a curiosity point of view when you reconstruct that identity with yourself during this time, and not a judgmental point of view. Also, it's very important, I think, for us in close quarters or, in communities.
I'm not sure I understand.
Sorry, my Siri is going off on my Apple Watch. Is to be able to be helpful in our interactions with others. If we know someone at work who's been diagnosed, do we look at them shamefully, or do we say they weren't careful, or are we judgmental towards them, or are we acting as a support system? I wonder what they need. Now they can't go out. And so it's very important not to shame those people who are feeling scared or who've been diagnosed. It's very easy, I think, to look at people and be frustrated because maybe they coughed and they didn't cover their cough, things like that. And so I think it's important to be as less judgmental and more helpful, specifically with shelter in place. Some people are abiding by this and some people aren't. So it's important that we come from a perspective of we're all trying to help each other instead of taking a very critical stance. I don't know that someone's going to change their way of thinking because we scream at them. Normalizing ambivalence. Again, this is that DBT. I really like this quote. I think it really talked about COVID right now. It's from Tolkien. It's a dangerous business, Frodo, going out your door. You step onto the road and if you don't keep your feet, there's no knowing where you might be swept off to. During this time, I think it's really important to avoid self-destructive actions. We're all scared. We're all feeling unsure. So in her research, she really focuses on some people respond with addictive type of behaviors or with self-destructive type of behaviors. So acknowledging that there are other coping skills and other ways to deal with these distressing emotions. And so we really want to make sure that we're assessing for drinking, self-harm, suicidal ideation, eating disorder, gambling, anything that could be self-destructive and something that someone may have had a past with. We want to teach them, again, those DBT skills of stop, improve, accept, the mindfulness skills that helps the patient take time to step back from their emotion, acknowledge the level of stress, and find new ways of dealing with that. Not only the DBT skills are important, but teaching communication skills in the family. So I'm feeling scared, I'm feeling left out, I'm feeling unsupported, those types of things. We want to assess past losses, because if someone is feeling very anxious right now and they really are having a hard time, it could have a compounding effect for the future, like I talked about, if we don't deal with it. But also maybe someone who's been through 9/11, like let's say you are in New York and people haven't really worked through all of those emotions. There's no closure. But if they're still stuck with some of those frozen grief, and then we add this pandemic on it right now, how are they managing it based on someone who maybe has worked through some other very serious, impactful losses? So we want to make sure as a therapist that we're asking them, does this remind you of any other time? Does this remind you of any other loss? And if you have kids at college that you can't get to, it could be worse if you have some of these past things that haven't been dealt with. Again, with ambivalence and the two kind of ways of thinking, like I really love my family and this is a great time because I get to spend time with them. And then I'm doing family therapy sessions where people are saying, if I get out of this without being divorced, I'll be lucky. So it's like, I'm grateful I have my family and I'm sick and tired of them. I want to go to work and I don't want to work from home, or this is really hard to do. I'm excited for this new baby to come and I don't want to deliver my baby alone. So all of these types of ambivalence are important to identify. We have to look at the way we've done attachment and done relationships and think about how we might have to do them differently. Bowlby says, when a relationship to a special loved person is endangered, we are not only anxious, but we are usually angry as well. As responses to the risk of loss, anxiety and anger go hand in hand. And this was sort of the thing I referred to with the foster care. But some people may feel very frustrated right now with other people who maybe aren't abiding by the social distancing, or they're feeling very frustrated because they can't see their loved ones. And so, you know, this space and how we're attaching to each other or not attaching to each other as a community, as families, and then in our more intimate, you know, dyads and relationships. So acknowledging that it's very difficult to right now maybe be at a social distance, learning how to strengthen new relationships. So one of the things that has happened to me during this COVID crisis is I don't really know my neighbors very well. And I've been getting to know them a little bit better just because, you know, the neighborhood, you see them on walks, maybe they ask you if you have toilet paper or do you need anything, or can I use your garbage can because mine is full and we've been staying home longer. So you're developing all of these new attachments that maybe you haven't had before. You might have to look at your boundaries and create new boundaries for the new situation. Ask yourself if you aren't able to connect with the person that you really want to because of the space or distance. If you can't get a hold of them, like someone's in a nursing home or things like that, you may ask yourself, well, what would they tell me to do? Or what would they advise me to do in a time like this? Basically, we're trying to shift from the sadness to a place of power. We're trying to let go of that emotional suffering and create more positive experiences using those DBT skills. One thing that I talk to my families about when I'm doing family therapy is understanding the sequencing. Well, I'm fed up and I'm anxious and I'm mad, and then, you know, that impacts another family member. They're feeling like maybe, well, you didn't see what I was trying to do. And the sequencing that we see in marriage counseling a lot is something that can be happening more frequently in the close quarters. So just understanding how we can stop people from spiraling and using our emotional, our communication skills of reflective listening and teaching the family how they may be sequencing and how to stop being reactive to that. Remember the others, the people who may need some help. There are some people who are really good in a crisis and some people who are not. So checking in and asking for new roles to be made if someone is doing really well and someone isn't, how they could provide or help the family. Group therapy, there's a lot of online self-help groups or support groups right now. This is really important because not only do you get help from others, but it provides accountability and unity. So, hey, last week you told me that you were going to try to do this. Did that work? Are you going to do that? How did that go? Did you find any obstacles? And learning how to be vulnerable. A lot of times people don't know how to talk about how they feel. So this new attachment stuff is encouraging that vulnerability with others. I'm running out of time, so I'm just going to run through my 6th principle, and then I'm just going to tell you a couple things about how I've applied them over the last 3 years. But this one is probably my most favorite one, which is discovering hope. As part of hope, Boss talks about spirituality. I like this quote from C.S. Lewis. It says, I pray because I can't help myself. I pray because I'm helpless. I pray because the need flows out of me all the time, waking and sleeping. It doesn't change God, it changes me. This is a time where a lot of people are embracing their spirituality because they learn that they're out of control with a lot of things in life. We need to ask ourselves what we can control, like can we turn to our higher power? Can we go on a walk in nature? Can we pray? Can we find meaning? And in some cultures, and I don't want to step on any toes here because I know there's so much diversity and I respect everybody's spiritual, like religious spiritual beliefs. And sometimes if someone's very angry with God, you may ask them to talk about that and to be real with their feelings and not be ashamed to process that in therapy, because they may feel like it's shameful to have those emotions towards your higher power. Hope versus hopelessness. Part of the the hope is just knowing that I don't know why everything happens, but what am I going to do about it? That puts you in a place of power. And so asking people, well, where can you go from this? What can you learn? What do you want your future to look like? And what are the possibilities of change, and what can become better after this? Like I said, we're finding things to do that we've never thought of before out of necessity, that we think, oh, well, that's really great. I think we're going to do this more often. I mean, just washing your hands. I think people don't realize how much they didn't, or how much they need to, and just learning new ways of doing things. Humor. I know this is kind of a off-color sign. There were a lot of things that were worse, some things, but I just put this on there because I think we need to use humor when we're talking about some of these things. It's not a laughing matter. COVID's very serious, but also we have to like lighten the mood sometimes in some ways. And so use humor when you're with your families. Use humor when you're with your patients to try and lighten the mood, and develop patience. I know some of us are more patient than others, but knowing that this is going to take a long time and we don't know the end point. Viktor Frankl said, "We who lived in concentration camps can remember the men who walked through the huts, comforting others, giving away their last piece of bread. They may have been few in number, but they offered sufficient proof that everything can be taken from a man, but one thing, the last of the human freedoms, to choose one's attitude in any given set of circumstances, to choose one's own way." So one thing I want to say before we turn it over for questions is I've kind of memorized these 6 steps of resiliency. And so when a patient is in my office and they're talking about something, either it's COVID or a divorce that's happening or their loved one's in jail, and all of these things have come up in the last few years, I try and fit which one, of course, would work best in that situation. What can you control? Well, who are you if you have someone who's in jail? Or how can we find hope? Or how can we make it so that you have more support? And I tell them about ambiguous loss, and then I choose one of these steps of resiliency, and then I do homework with them to try and get them to practice these steps of resiliency so that they can find ways themselves to be powerful in their lives. Tamara, I think that's all I have, so I can turn it over for questions.
Hi, Melissa. Let me get my screen up here. Hang tight, everybody. There we go. Nope.
Do you just want to tell me some of the questions?
Yeah, so we have a couple. First of all, there was can you hear me okay, Melissa? Because I can't see myself. So.
Yeah, I can hear you.
Okay, great. Thank you. We had lots of comments and people asking about being able to view this later or to share the webinar with other people, if that's still possible. And the answer to that is yes. That we have recorded the webinar, and in probably by tomorrow it will be posted on our website. If you go to centerforchange.com and you click on the professionals tab across the top, then you'll see a tab for webinars, and if you click on that and scroll down just a little bit, you'll get to the archived section, and that's where you will find a copy of the webinar recording, and so you're welcome to view that. Just keep in mind that continuing education credit is only available for the live version, but you're more than welcome to view that recording anytime. Okay, Melissa, now here's a question. Oh, now I can see everybody, or see myself and you. Any resources on how to support people who are sick with COVID-19 and are alone in isolation at home?
That's a great question. I don't know if every state has, like I know the state of Utah has a COVID-19 website, and you can go to that and they have resources, and in the resources there's oftentimes things that you can do, for example, to reach out or to connect with other people. There might be specific, what I would say from this presentation is, don't be afraid to talk about it. Don't be afraid to ask how they're feeling, what they need. Your state may have more or less resources than other states on their COVID website. The CDC has resources on their website where you can go to that, and it has some emotional things as well. So you can do a little bit of research and seeing what states have to offer what. This is not exactly the same thing, but if you're a therapist, some of the resources that we've come up as a corporation are doing a lot of work through workbooks and kind of homework. So if someone's at home and they're really needing to challenge distorted thoughts, you can give them some things to work on so that every day they're looking at, not catastrophizing, not rationalization, those types of things. So I think it's such a brand new thing. There's a lot on the medical, and there's not as much, I think, on the emotional. But again, if you go to every state, you should be able to find some resources in there to help your loved ones.
Thanks, Melissa. One more. This says, I'm wondering how to best support a friend who has lost a father and was unable to have a goodbye, also unable to be with his family or hold a funeral, etc.
Exactly. When I talk about this before COVID, I actually talked about how it was happening in the concentration camps. So one of the things you can do in ambiguous loss is create rituals. So within the Jewish community and other religion, like in the Jewish community during the Holocaust, they weren't able to have, your funeral rituals. Obviously, it was something that was horrible that was taken away from them. And one thing they are doing in Europe right now are these stumbling stones where they found the last place a person was taken from. They have the name of the person. It's embedded in the sidewalk. They have a new ritual to help with that. And so the theory is, if we create new rituals for things that we would have liked to have been there for, but we couldn't, and we do it now or later, after the fact, we can show some honoring of our loved ones, and we can find a new way to sort of say goodbye. That is a very hard thing right now. People are not allowed into a hospital if they're sick and they're dying. I have heard of people being able to FaceTime if a nurse is so willing to do that with someone in the hospital, or the nurses are holding their hands. It's just tough. It makes me cry. But I would suggest creating some rituals in the family after the fact that honor the person and cannot replace that moment that was lost, but that can move forward.
Thank you, Melissa. The whole thing was amazing and beautiful, and grateful that you would share it. And we have lots of comments that are saying that same thing. So thank you. Before we end, just two.
I'm sorry. I apologize.
Don't apologize.
I'm an emotional person in general.
Same.
It was hard for me to make it through, but I really appreciate everybody attending.
Thank you, Melissa. Before we end the webinar, two things. Number one, when I click end and I end the webinar for everybody, you'll have a pop-up with an evaluation. If you'll take just 1 minute, please, to complete that, that would be wonderful. As I mentioned at the beginning of the webinar, that's a continuing education requirement for us, that we gather that data. It's completely anonymous, and it just gives good feedback that we have to send to the CE entities, and we also take a look at those comments to see what we can do moving forward to improve or do things differently. And then the most important thing is that if you're interested in getting continuing education credit for this webinar, you need to complete the online test in order to receive credit. The link to that test will come in a separate email about an hour from now. You'll start to get those emails, and if you've signed up individually with your individual email, then you will get a specific link for you to take the test. Once you take the test online and pass it, it will automatically download the completion certificate to your computer. And sometimes it goes directly to your downloads file. So if you don't see it, look in your downloads file and see if it's there. I think that's it. Thank you again for joining us today. Please stay well. Bye-bye.